Evening and welcome to our first virtual Fund a Fellow program. For those of you that are new to Fund a Fellow, I'm Rick Shenna, co-founder of Fund a Fellow. Unfortunately, we can't be face-to-face tonight to share a laugh, a story, and a good glass of wine. However, all of us at Fund a Fellow are excited to share a laugh, a story, and a cocktail over Zoom. And that's what we're going to be doing this evening. And we're going to do that to continue our mission of Fund a Fellow. The Zoom format we are going to use this evening is a first for all of us at Fund a Fellow. So please accept our apologies in advance if we have any technical glitches, as you probably already know, as we started at about 10 minutes late. We'd also like to hear from you regarding specific topic or subjects, areas you would like for us to focus on in future Fund a Fellow virtual programs. The original Fund a Fellow dinner format provided for 3 dinners a year. While all of us at Fund a Fellow enjoyed and will miss the original dinner format, especially the open bar, we've had no choice but to move to a virtual program due to COVID-19. Ultimately, when it's safe to do so, we'd like to return to having a number of in-person dinners once again. Now that we're transitioning over to a virtual format, we are looking at possibly adding additional programs, provided the feedback we get from you indicates that you would like for us to add additional programs. So if you like what you see and you want to see more, please let us know. Over the past 6+ years, we've averaged around 100 attendees at the Fund a Fellow dinner evenings that we held at Georgetown Levy Center. If there's one thing that we can all agree on in Washington, D.C. today, it is COVID-19 has almost overnight changed the way we live our lives and communicate. We're excited about this new virtual format. We believe moving to a virtual platform will enable us to broaden the reach of Fund a Fellow. It'll give us the ability to reach out to more people, and that's a wonderful thing. Since we have a good number of guests joining us this evening that have never been part of Fund a Fellow, we thought it would be appropriate to say a few words about Fund a Fellow and share with you a brief history of the program. It is my distinct pleasure to introduce to you a very special person. She is a great friend, she's smart, funny, and without her leadership, Fund a Fellow would never have happened. It just would have been another good idea. When we started Fund a Fellow, I quickly realized this was a perfect setup for me. She would do all the work and I would get all the credit. It is a privilege to introduce you to the co-founder of Fund a Fellow, Ms. Janice Buchanan.
Thank you, Rick. And I hope you don't believe everything you hear. But let me add my welcome and express just how much we wish we could see you this evening. The Fund a Fellow program has provided funding for fellowships at Georgetown's Movement Disorders program since 2013. 100% of the funds raised go to Fund a Fellow, and last year we funded 5 fellows, all board certified neurologists training to be Parkinson's experts. To give you a little history, my husband Wiley and I met Rick and Donna Shenna at a PFNCA event back in 2011. We quickly realized that Wiley and Rick both received their care from Dr. Pagan. So of course we were singing his praises, and I told Rick that I was working with Georgetown's advancement office trying to find a way to support Dr. Pagan's work. Rick leaned across the table and said, "I'm in." And so we were on. A few months later, we had lunch with Dr. Pagan and we asked him, what can we do to help you? And Dr. Pagan very quickly replied, I could really use another fellow. And then he explained that that a fellowship is a 2-year program, and it's, as I said before, it's a trained neurologist, and that about half the time of that in the fellowship would be spent in the lab doing Parkinson's research, and the other half of the time they would be spending in the clinic with him learning to diagnose and treat Parkinson's disease. So Rick and I did some research, and we found that, in fact, there weren't enough movement disorder specialists across the United States. And that's still the case today. Here's what we discovered. At that time, it could take about 8 months to get a first appointment with a specialist. And only 25% of Parkinson's patients actually got to see a Parkinson's specialist. And this is one that I really was surprised about. Some states actually had 0 specialists. These numbers have not changed much, and the lack of trained specialists affects not only the quality of care to patients, but also diagnostic error rates. It takes training and focused experience to accurately diagnose and treat Parkinson's disease. So Rick and I worked diligently along with Georgetown's Advancement Office throughout 2012 to define a concept so that we could raise the funds that Dr. Pagan needed for the additional fellow. At the time, a fellow cost about $75,000. And since it was a 2-year fellowship, we had to come up with a concept that would consistently raise funds every year. So by the spring of 2013, we had almost raised the funds we needed. Georgetown took a risk, and Dr. Pagan hired Dr. Worsen Mills, his first Fund a Fellow. We also had our first Fund a Fellow dinner program in June of 2013, and we were off to the races. Since then, we have funded 16 fellows by raising over $2 million and have held 17 dinner programs. Our dinner programs are completely free to anyone who would like to attend, and we raise money through the generous donations of people like you. This year, we're funding 5 fellows from the $350,000 we raised last year. But the benefits of Fund a Fellow have not stopped there. Through our programs and the thriving Fund a Fellow community, we have increased patient education. We've provided informal time between the doctors and their patients at the dinner programs, and increased funding for research. The most notable example of this being the nilotinib clinical trials. So, while we miss seeing you tonight, we are very optimistic about Fund a Fellow and actually excited about the virtual format. We will see each other again, but in the meantime, we can keep the information flowing with you and the comfort and safety of your homes. And hopefully more programs will be able to offer more programs virtually this year than we were able to do at the Levy Center last year. So at this point, I'd like to introduce Mark Antonucci. Mark is the new point person in Georgetown's Advancement Office for Fund a Fellow. Mark?
Thanks, Janice. I'm excited to be serving as Advancement's new point person for the Fund a Fellow program, and just wanted to say thank you all for joining this evening and for all of your support of this important work. I'd like to also extend a special thank you to Janice and Rick for all of their leadership over the years with this program and for all of their guidance over the past several months as I transitioned into this role. And I hope that I'll have the chance in the coming months to meet you all virtually and at some point in person again. And it's now my pleasure to pass it over to Dr. Fernando Pagan, co-director of our Movement Disorders program. He's going to provide some updates on his work, and that'll be followed by a panel discussion, and we have dedicated some time to answering your questions as well. So thanks very much for joining us, and Dr. Pagan, take it away.
Okay, good evening, everybody. Hope you can hear me. I want to just start by thanking everybody for being here this evening. These are definitely unprecedented times, and today we're going to talk a little bit about, with these times, there's also new opportunities. So we'll definitely talk about these new opportunities during our panel discussion. But I need to thank the development team at Georgetown, Mark, Claire, the whole entire development team at Georgetown University Medical Center, for helping us out over the years. This is the 7th year now, where we are funding positions for a much needed need, and that's really fellowship training for neurologists who want to go into movement disorders, and it's still a very underdeveloped field. So I want to thank you from the bottom of my heart, and I want to thank everybody here today for the Fund a Fellow virtually, for all your support in the past and for the future support. because we can't do it without you. So thank you again for the bottom of my heart. Also, a huge virtual hug and a great thanks to both Ms. Janice Buchanan and Mr. Rick Shenna. It's just been an unbelievable journey. You've been great leaders. You work so well together. There's still so much more to come, but I just want to thank you for everything that you've done for Georgetown University Medical Center, MedStar Georgetown University Hospital, and all the patients in our area that have benefited for all the fellows that we've treated. So we definitely have open access over the years, and I'm happy to say that in the history of the program, we're now training our 32nd fellow. So this is unbelievable. Ever since our fellowship program began in 2005, and you know, this year's class we have 3 first-year fellows and 2 senior fellows, and I'll introduce them in a second. So we are training 5 new fellows into the movement disorder family. So it is absolutely amazing. And again, this is a real big need in our community because there is no federal funding for fellows. So these are people who have already finished their neurology residency training. They're board eligible. Most of my fellows become board certified before they finish their program. So these are board certified neurologists who have an interest in movement disorders, and there's such a huge need. So our 2 senior fellows this year, I don't know if I can show them if they can unmask, but the first one is Dr. Carwin, Amelia Carwin. Actually, they showed Dr. Akano, our second fellow, our second senior fellow. So hi, Dr. Akano. It's great to see you. And he'll be joining us in the evening. He'll be closing out the program. And then also Dr. Amelia Carwin. I see her down at the bottom, but she'll give a virtual hello. Hopefully there she is. So,
hi, everyone.
And you know, our 2 senior fellows have just done a tremendous job this with last year, a big shift in the way that we deliver medicine. You know, a lot of our patients have learned sometimes seeing their children in the background while they're delivering care because they're both wonderful parents, and they're just not only are they taking care of their children, but also delivering care sometimes from home. And we'll be talking about how telemedicine and video medicine really has taken a significant leap into into our clinics. Our clinics have become virtual now, and there's some good and some bad about it, but a lot of good. And these 2 individuals have definitely been pioneers now in telemedicine and have just really helped reshape the way that we deliver care, and they're great leaders and teachers for their junior fellows. So I want to thank both Dr. Carwin and Dr. Nakano for the amazing work they've done. And we've even begun to do research virtually too. So there's so much that we're doing, so much that we're adapting, and these 2 have been tremendous leaders, and they have adapted so quickly in the face of this pandemic. And I know they're going to do some wonderful work in the future as well. And then now I'd like to introduce our 3 new first-year fellows who they were in residency when the pandemic began, and they've been shifting very quickly to learn how to treat both movement disorders in person as well as via telemedicine as well. So we have Dr. Patel, Dr. Farzel, and Dr. Gadani. So Dr. Sanj Patel, Dr. Zara Farzel, and Dr. Anvi Gadani are 3 first-year fellows. Dr. Patel came from Thomas Jefferson University. Dr. Farzel came from our program here at Georgetown University Hospital, finished her residency training in Georgetown and joined our movement disorder program. And Dr. Gadani came from the University of Connecticut. Again, 3 very, very well-trained neurologists, and very bright, very sharp, and just one of the most cohesive teams that I think I've had in a very long time. 5 people working so well together during these difficult times, and the maturity is there, and just adapting to a new way of delivering medicine. I couldn't have a better team during these challenging times, and it's just been so much fun to be able to work with these 5 individuals. I always want to thank our movement disorder attendings. So we have to think about teaching these fellows and giving the best education possible. So it's not only myself that does all the teaching, so they work through multiple different types of clinics. So I want to give a big shout out to Dr. Lowe, Dr. Baru, Dr. Amjad, Dr. Constantino, Dr. Lin, Dr. Gambier, Dr. Mundell, Dr. Torres-Yaghi. These are really the cornerstones. These are phenomenal teachers. They have a lot of specialty clinics. The program is very unique because not only do we have a lot of clinics, virtually and live clinics, there's a lot of research going on, a lot of work being done with the translational neurotherapeutics program at Georgetown University Medical Center with Dr. Charbel Musa. A lot of questions I know are coming about the different research trials, and we'll definitely hit those during the answering questions. And then the education that we do, not only for fellows, but for medical students and residents as well. So a lot going on in this particular program. And then we have some very special people in our program that I think are a little unique to our program. We have amazing nurse practitioners. I always give a big shout out to Barbara Wilmarth because she's been there with me from day number 1. So she's really helped me train all the fellows from day number 1. Her work ethic is amazing. And again, she does not only a great job in the clinics, but also with all the research clinical trials. We also have one of the most amazing outreach coordinators who really runs our Center of Excellence for Parkinson's disease. So we have the Parkinson's Foundation Center of Excellence, and that's run by Ms. Helen Howard, who's been there from day number 1, and her dedication is unbelievable. And being able to adapt to a more virtual environment and work, she's probably the only one person that has come in every single day during the pandemic. There was never a day that she didn't show up for work. She's just an amazing individual. And then we have a nurse navigator, and she's also the manager of a new clinic that we have for chronic care management and a comprehensive cognition clinic, and that's Nurse Joy Arellano. So she moved into a more clinical role, and she really is just tremendous with our patients and really being there and really together with Helen Howard and I think Joy Arellano and Nurse Joy Arellano and Helen Howard. They're really our patient advocates, and we're really going to try to expand on that in the future to really have more patient advocates and improve accessibility and really streamline the situation as we move things along. So again, this is where we are right now, and a lot going on in our program, and a lot of it is done because we do have the fellowship program, because not only are we teaching them how to care for our patients, we're also teaching them how to use the most recent medications that have come out in Parkinson's. The last 2 years, we've had over 5 new medicines that have come out in movement disorder. So we're teaching our fellows how to use these medicines, but we're also doing research in these medicines as well. By the time they come out, we've already used them in the clinical research trials, and we have a lot of different clinical research trials that the fellows are also involved. So it's a real exciting time. We're back open. Still doing mostly everything virtually, but a lot of our research trials have also started back up. And again, this cannot have this can't be done without the participation of our entire team. So it really is a huge team that we have, but that's what we need to be able to take care of our community. And again, the first principle that we always learn is the cura personalis. We want to take care of the whole entire person. And again, that's part of our Jesuit tradition, and that is exactly what we're trying to do in our clinics. We want to take care of the whole entire person, the people around the individuals with Parkinson's disease, and that's what we're teaching our fellows, how to take care of the whole entire person and look at the person as a whole, give them dignity and the best quality of life possible. And hopefully we'll find something to stop the progression and slow the progression, and we're working hard with that in research. So with that, I'd like to open it up for our discussion today and bring on Dr. Torres-Yaghi. who is the clinical director of the Parkinson and Dementia Clinic. He's now been attending with us for over 4 years. He's an amazing young neurologist, actually he's a very seasoned neurologist already, and he just does a tremendous job in our clinic and also educating our fellows and residents not only in movement disorders but in the cognitive disorders as well. So I'd like to open it up to Dr. Torres-Yaghi, so hopefully he can join me here today. There he is.
Hi, everybody. Thank you, Dr. Pagan. That's such a nice introduction. And thank you to Janice and to Rick for their great words. You know, it really is great to be able to connect with everybody despite the pandemic environment. We remain hopeful that things will get better as the science progresses and as we continue to adjust to everything that's going on. The most important thing is to remain connected like we're doing now. So I'm so happy to be part of this conversation and presentation as a panelist so that we can continue to stay connected and improve the access. That's been our goal over the past few months, to not allow what's going on with the pandemic to affect the access of our patients so that we can continue to give the best care possible despite everything that's happening.
Thank you, Dr. Yaghi. So today, Dr. Torres-Yaghi and I are going to be discussing how to navigate Parkinson's in the time of COVID-19. So that's going to be kind of our little discussion. So we're going to have a little panel discussion with Dr. Torres-Yaghi and myself. And so Dr. Torres-Yaghi, so the first question that we have today in our panel is, you know, how does coronavirus affect people with Parkinson's? So can you just broadly kind of define how COVID-19 specifically can affect Parkinson's disease patients?
And that's a very important question, and it's a question that we've been getting a lot through our virtual visits with our patients. You know, rightly so, the concern is, and usually the major question from patients is the fact that I have Parkinson's disease, number one, what can happen because of a COVID infection? And then number two, am I at a higher risk because of my condition of having any sort of complications? And the first way we describe it is that, and it's like we describe any infection, anyone who has a chronic underlying condition, like Parkinson's disease, if we get a small infection, even something as simple as a chest cold or something as simple as a head cold or a urinary tract infection, an infection, unfortunately, can trigger our underlying condition, and our underlying condition can get worse. And so we might see, for example, if we had a COVID infection, we might see our tremors getting worse, some of our Parkinsonian motor features getting worse, like stiffness. We might have some of our symptoms become enhanced due to the infection. In people that are also suffering from other issues, such as some cognitive impairment, we might see a little bit of confusion also set in. But it's not to worry. You know, we remain hopeful in our patients. You know, our goal is to continue to tell them and give them hope that just like the infection would hopefully be a temporary one and we would get through it, the enhancement of those symptoms, those Parkinsonian symptoms, would also improve over time with the resolution of the infection.
So really, what you're talking about is that Parkinson's doesn't put people necessarily at risk for COVID-19. So still, the major comorbidities that makes COVID-19 worse, for example, is still diabetes, hypertension, and underlying lung problems are still the main ones. But if a Parkinson's patient does have some difficulty with their lung function or swallowing difficulties or some heart problems, that may change things, correct?
That's right, and exactly. So a lot of the times when we're trying to figure out whether or not a patient is at a higher risk of complications, as Dr. Pagan said, we look for three major issues: hypertension, diabetes, and chronic lung conditions. Those are the major diagnoses or chronic underlying conditions that we tend to consider higher risk. And in those patients that also have those comorbidities, we ask them just to employ all of the measures of social distancing, just to ensure that they're doing everything possible to make sure that they're mitigating the risk of contracting COVID.
Are there any Parkinson's disease medications that you can think of that may worsen COVID?
So when we think about all of our medications, the Parkinson's disease medications, really what puts us at a higher risk are the chronic conditions. And so any medication that were to either increase your blood pressure or cause any sugar dysregulation in the blood may be of concern. In our patient population and the medications that we prescribe, we don't think that we see any sort of heightened risk because of administration of our medicines. Our medicines tend to help with motor symptoms, and a lot of our medicines actually, when you use medications that are dopaminergic in nature, a lot of them actually can lower the blood pressure, which might be, an added positive in our patient population.
Okay. Excellent. So besides age, diabetes, hypertension, underlying lung problems, those are really the big risk factors for increased morbidity with an infection. But definitely, I think our Parkinson's patients, a lot of them may be in that age group. So definitely, the socially distancing, taking care of yourself, washing your hands every day very carefully, just basically following what Dr. Fauci et al. Recommended across the board. Those are the things that are going to be very important to do. But there's been a lot of changes with COVID-19, the pandemic. What's been some of the silver linings with the pandemic? What are some of the positive things that you've seen with the pandemic?
Well, so Dr. Pagan and I remember when it all happened, because we actually were supposed to present a lot of our data at an international meeting in February. And I remember being one of the first institutions in the country having to cancel our trip. And it wasn't until about a week later where other institutions followed suit. And ever since then, Dr. Pagan and I and the rest of the team, with the fellows involved and everyone else, Helen Howard, Joy Ariano, Barbara Wilmarth, all of our team, as Dr. Pagan said, it's a big team. We said, how are we going to pivot? How are we not going to let this condition and this pandemic affect our ability to care for our patients? And we readily adjusted. And we tried to make lemonade out of these lemons that were handed to us. I always say that backwards. I remember we took one day where we said, okay, we have to reorganize and figure out how we're going to do it. So we took that one day, we mobilized, and we said, okay, we're going to get onto our telemedicine platforms, and we're going to do everything within our power to teach our patients, to become more used to the technology. And so what we've been able to do is really kind of create a different way of connecting with our patients. And the silver lining there is that we've been able to actually improve access by close to 30%. And so our goal was, to maintain our access, but in fact, we've been able to create certain things out of this. One being a specialized call center. So when patients call and they have an issue or they need any advice from one of our team, we have a special call center where it could either be a virtual visit, just like this one where we have a virtual kind of encounter, or we just simply schedule a phone call and we talk through things and try and give the best recommendations possible. Those are the first things that we did.
Yeah, so you're right. So there's been a lot of changes. So I think definitely by switching over to telemedicine, we were definitely catapulted into telemedicine. And for about 10 years now, we've been seeing, especially within the movement disorder field, the potential necessary benefits of telemedicine. But the pandemic pushed us right into it overnight, and all the red tape that was there for years trying to get telemedicine started was gone in basically overnight. So really catapulted it into us, and now we had a new platform. Actually, practicing medicine almost became like the wild, wild west a little bit. It was the term that I used because we were able to use not only Zoom, we were able to use FaceTime, we were able to use the telephone, all these WebEx type of platforms. If there was a platform, we were now allowed to use it. So HIPAA went out the wayside, and everything was kind of relaxed. But this was all very important because it put the patient first. That's what, by relaxing all of that, it allowed us physicians to be able to take care of our patients, regardless if they were in Washington, D.C., Virginia, Maryland, stuck in California, down in Florida, up in New England, or around the world. So it really put our ability to take care of our patients regardless where they were. Before this, if I wanted to be able to take care of a patient who was down in Florida, I had to have a license in Florida. So definitely the relaxation of all these restrictions went away very quickly, so allowed us to access. And one of the things that has happened is that the first few weeks, the first few months, we kind of were like, okay, let's just maintain. But life went on. We had to continue to adjust Parkinson's medicines. In the meantime, we got all these new medications FDA approved. So we're starting some new medications using telemedicine nowadays. But now, in the past, we would have to wait 3 months to see the person to see how they were doing with the new medication. Now with our call center, sometimes we're seeing the patient 2, 3, or 4 weeks later via telemedicine. And our fellows are running this call center, being able to see the immediate benefits of some of these medicines within 3 to 4 weeks sometimes, where sometimes we're waiting up to a month, 3 months or 4 months to be able to see them. So, there's definitely a lot less travel for us physicians. So we have a little bit more time for clinic. And then also there's less travel for the patient. So a lot of times our patients were traveling in 1 or 2 hours to come in, find parking. You know how difficult it could be to find parking at Georgetown, get into clinic, be there for a clinic, and then drive back 1.5 hours. So we're saving for some patients 2 or 3 hours of travel time to be able to come in. So there are a lot of benefits. And one of the advances that we've seen also is I always thought that this platform would be very good for speech therapy, for example. And what we're seeing is a lot of speech therapy, physical therapy, occupational therapy being done through a telemedicine platform, especially speech therapy using this technique like the Zoom is perfect. And again, the amount of time that's saved for a patient and their family because they don't have to travel in and out, find parking, pay for parking, etc. Speech therapy is a no-brainer. And, we're hopeful that we not only as physicians, but I think as a community, both patients or caregivers, physicians who take care of patients, we definitely have to advocate that this avenue stays open for years to come because there is a lot of benefit to it. Again, nothing is more important than seeing each other face to face, and I think there's always going to be a need for that, and I think we're definitely better physicians face to face and being able to feel the rigidity, et cetera, do the pull test. But there's certain instances where this platform can be very helpful, and I think that's what it's taught us. All this red tape before, whether or not this was going to be a good platform or not, that's all out the window, and it's opened up a new form for us. And we've seen it even before the pandemic. A lot of mental health was also being done this way. And if you didn't have I even heard some commercials. If you have a telephone or you have If you have FaceTime, you can have a psychologist, and you can have psychology over the phone and talk to somebody. But again, there are a lot of benefits that can come from this. So these are definitely some of the silver linings that have come out of this pandemic. Because of the pandemic, there are other things that our patients have to manage. So what have you seen, and how would you recommend, Dr. Torres-Yaghi, for our patients to manage their mental health, anxiety, or stress? Because the socialization just isn't there like it was before. So how would you advise your patients, and then especially exercise, etc.?
So what we try and teach, a lot of what we do is education, and so and a lot of what we do as movement disorder specialists is our goal is to advocate for our patients and to lead our patients down the right track when it comes to sometimes figuring out what are the things that we can do to make things better, because so much of our care, some of it is pharmacologic in nature, but so much of it is a supportive sort of what can we do differently in terms of our lifestyle. So minimizing stress, of course, is something that's always important. Improving sleep quality, making sure we sleep, all of those things, we always tend to ask our patients to improve their lifestyle to the point where they can make things better on those two ends. Given everything that's happening, we are seeing that because of the stress and everything that's happening with coronavirus, we are seeing that a lot of our patients are suffering from depression, anxiety, and a heightened sense of those two issues. And so what we tend to say is we have to create a routine. We always say routine is good, but if we can create a routine and, again, make lemonade out of these lemons, these are big lemons that have come our way, and our patients are suffering from so many things. But when we look at the silver linings, and I think the goal of today is to kind of mention the silver linings and hone in on them, spending more time with family at home, getting used to being together. My wife and I were talking the other day. We said we're spending a lot more time together. There's a lot of negative things that are happening, but a lot of positive things. Our communication has improved because we're spending so much more time together. The other thing is thinking about using medicine during this time frame might be a good time. I had a patient who told me, I'm worried about starting a new medication with this environment. I said, that makes sense, but there might be an actual good part to this. Being at home and being with your partner and with family, being able to watch you, this might be actually a perfect time to think about adjusting a medicine. And then we talk about exercise. We've always said, there are certain things that could be disease modifying, keeping symptoms at bay, improving quality of life, improving functionality. And exercise is one of the best things that we can do. And now, developing some sort of exercise routine, and like Dr. Pagan said, with speech therapy, that can be done virtually. We've actually started offering, or we've been offering since all of this happened, online physical therapy. The physical therapy is happening. We even have cognitive therapy that the speech therapist can implement over video. And so if we can get ourselves onto these tech platforms and then go through the motions of creating that sort of routine with things that are healthy for us, I think we'll be able to come out of all of this, maybe even in a better place than had all of this not happened.
So there's definitely been a lot of changes, as you said. I think definitely we have to take care of our mental health. We have to find ways to reduce our anxiety or stress, definitely by keeping exercising is something very important, making sure we do the social distancing, but still be able to find a way to see our family and friends, I think is very important. And I think one of the nice things too is that some of the programs that used to be all around our area, especially for our patients, all the wellness programs, a lot of them are virtually now. So it's a good idea to make sure that you go on the website, especially something in our local area like the Parkinson Foundation National Capital Area. There's a lot of wellness programs available. Now you don't have to live live in Maryland to go to some of the Maryland types. You can go anywhere because these wellness programs are available virtually. So the Parkinson's Foundation had their yearly walk virtually, and then the Parkinson's Foundation National Capital Area is also going to have their walk virtually through their walk-off. And again, there's going to be a lot of different programs, so there's a lot of adjustments. But I think the Parkinson's Foundation National Capital Area has done a tremendous job to really make these wellness programs available virtually and to be there for Parkinson's patients and their caregivers. And again, this is there is a little bit of a changing time. As the weather becomes a little cooler, and if you're able to, definitely make sure you get outside. Have a mask in case there's too many people, but make sure that you can at least walk, enjoy, do your exercising. So again, take the proper precautions always at all times. But I think that's really, really important. Make sure also during these times that you have plenty of your medications. I would always recommend don't wait till you're at your last pill. So you start to see that you're running out of your medicines, you may need refills. Call a few weeks ahead of time because the phones are very busy. So make sure that you don't run out of medicine. So making sure that you have plenty of time to get the medicines. Luckily, I think the mail has finally kind of caught up. It's not as delayed as it was because, again, at first, everything pretty much shut down. Things have been opening up better, and we're seeing more access. So it's a good sign when you can see toilet paper on the shelves again. That means that we can get our medicines hopefully too. So these are all things that are definitely important. So how would you advise somebody the risk benefit of a caregiver? I think sometimes there may be a little bit of anxiety of having healthcare aides. As a young parent, I think you may have similar types of anxieties about thinking about whether you're going to have a nanny or somebody there to take care of your young child. So what would your advice be to somebody considering whether they're going to have a caregiver or not at home for their loved one dealing with Parkinson's or some of these other neurodegenerative disorders like Lewy body disease, Alzheimer's, etc.?
It's a great question, and it's we really kind of have to put it all into perspective. So when we think about where we are now in comparison to where we were, when you think about the actual transmissibility, a lot has changed. Our population, meaning in the city, and our society has really been able to, in general, try to adopt the measures that are necessary. A lot of our social distancing efforts are now hopefully being seen, and so when we think about transmissibility, I think we're in a much better place than we were. That's number one. Number two, it is unfortunate that when we have other people that do need, they're essential to take care of our loved ones, our patients that have Parkinson's disease, Lewy body disease, and need a higher level of care and need a caregiver to come into the home. We are unfortunately having to kind of weigh the risks and the benefits. Like Dr. Pagan said, he knows that we were talking about it over this past week. I have someone to help us. My wife is working full-time as a doctor. I'm working full-time as a doctor. A lot hasn't changed for us. We actually are still going into work. We're still interfacing as much as we can in clinic. But we've had to allow for our help to come in and take care of our son during the day when my wife isn't able to be here and I'm not able to be here. So what we've done is we've tried to understand what it is that the person that's coming in the home is doing. So on outside, so we would understand, are they also implementing those measures? We've talked to them about that. I think when we tell our patients, it's very important to also talk to the person that's coming in and making sure that they are also using all the precautions necessary and that their loved ones are also doing the same thing. What's also helpful is to know if the caregiver is going to other locations or other homes. It might be important to find a caregiver that might at that time be able to kind of be more exclusive and stay in one home, your own home. But using those measures, like we said, washing your hands, hygiene as much, hand hygiene as much as possible, wearing masks, surgical masks, or some sort of precautions might actually be helpful. Like we do in our clinic, we actually wear our surgical masks and we try to maintain social distancing because we are in an enclosed setting. And now that the weather is nice, you know, trying to do things outside whenever possible can actually also mitigate the risk.
So definitely there, a lot of times having a caregiver is necessary. So definitely knowing the person, there's a level of trust there. You have to trust that the individual is also doing the right things to try to prevent contracting diseases themselves. And if there's any sickness or any illness, being able to immediately tell the family so that no unnecessary exposure. So, you know, it's the same thing with us physicians going into work. If we feel that we're ill or we have any symptoms, we can't come to work, you know, so we immediately have to go get tested. So we're under certain rules as well. So I think there definitely needs to be a little bit level of trust with a caregiver, and I think that's there's risk benefits, but just like with routine medical care, we don't want people not receiving routine medical care because people still have medical issues, and I think a lot of people held off a lot of important medical care, especially when the country got shut down. And I think a lot of people really, especially not only in mental illness, but people who may have had hypertension or other illnesses, you know, here they were having to go to an emergency room during a pandemic or something like that. But we have to take care of each other and take care of those medical care issues, even not only associated with Parkinson's, right? We still need to take care of our hypertension, diabetes, hypercholesterolemia. We have to continue to take care of ourselves. In pediatrics, a lot of children withheld going to get their immunizations, and that puts them at a bigger risk of not only getting, we're trying to avoid COVID, but that could put you at bigger risk to getting the measles, mumps, rubella, et cetera. So it's important to still maintain getting your other medical care as well. So I'm getting some interesting questions, Dr. Torres-Yaghi. So can you tell us some of the limitations with telemedicine, assessing patients with Parkinson's, maybe some of the limitations with when Parkinson's patients need procedures? So what are some of those limitations that we have with telemedicine?
Great question. So when I still remember what first got me to fall in love with movement disorders is loving to work with Dr. Pagan. And I still remember the first month he told me, I think we were rotating in the hospital, he goes, Dr. Torres-Yaghi, neurology is the last field, and in particular movement disorders is one of the last fields in all of medicine where the clinical exam is the most important piece of our overall ability to diagnose and help somebody. And I didn't really understand until I really became a fellow and I was able to understand and work through the different clinical exam techniques that we use. So nothing will ever replace an in-person examination. And that's why whenever we think about, we can see a lot, but being face-to-face with someone in person is invaluable. Things like checking people's muscle tone. We have a lot of rigidity, for example, in Parkinson's disease. We check for diagnostic purposes and for therapeutic monitoring. We check people's stiffness. And you'll notice when we used to come into the clinic, we'd rotate your wrist, we'd rotate your foot and your leg. Sometimes we'd rotate your neck to see if there's any stiffness or rigidity. The other things that are important to always test in neurology is strength, sensation, reflexes. A lot of our examination is face-to-face and is touching. And so we are limited in that sense. However, the ability to connect has also been invaluable. As Dr. Pagan said, being able to follow a patient now with a little bit of improved access, more longitudinally, being able to say, maybe in 2 weeks we'll see each other, see how this change helped you? Improving our access with the fellows has helped us, think of the silver linings and ways to actually improve care despite these limitations. The other things that tend to be limiting with telemedicine, a lot of the times, if you don't have a strong system or a strong connection, that does limit us. And so it really is important for both us as practitioners and healthcare workers to really be up to speed with everything that's happening with technology and use the best platforms possible so that we can enhance as much as possible the voice and the video, because actually there's a lot that we can see through video that helps us, especially for follow-up cases, new patients. We have still had to see patients in person in many cases. And then for procedures was the second part of the question. When we know that almost half of what we do is very much reliant on our procedures. For our Botox injections, our DBS calibrations, we have our Duopa pump titrations, and moving forward in the future, we're gonna have other surgical treatment modalities that will need face-to-face encounters. And so those sorts of things we have to be able to integrate and hybridize. And so I think now we're at a point where we are in the process of hybridizing the clinic with both telemedicine and in-person visits.
Yeah, I think that's a wonderful point. I think we really have transformed more into a hybrid type of clinic where we see our patients for procedures, and but then we can then follow up with them virtually, or if we really need to see somebody face to face, we see them, and then we follow it up with a virtual check-in, a virtual visit. So this hybrid notion really kind of takes the best from both worlds. So even though telemedicine isn't perfect, again, like you said, there are a lot of beneficial components of it. So somebody asked me also, they want to know the number to the call center since you brought it up.
So Dr. Pagan and I have been so excited about this call center. So right now, I think the best phone number that we have, so we have multiple phone numbers, but our medical assistance phone number is 202-444-6087. But it's also the other phone numbers that we already have. So Helen's phone number, Joy Arellano's phone number, those are the best ways to get in touch with us through the call center. And it can also be virtual. So if we feel that it's important to do it virtually, for example, if someone's experiencing motor fluctuations, which can happen, and we're trying to distinguish between wearing off and dyskinesia. I remember when I was a fellow, a lot of the times, since we weren't using virtual visits or telemedicine, it would be a lot of conversation. Now I'm noticing and say, okay, hold on a second. What platform do you use? And the patient will say, well, I use this platform. I say, okay, let's see. And I'll say, oh, look, that's actually a dyskinesia. It's not a tremor from wearing off. And so, that sort of ability to pivot has really enhanced our ability to practice.
Excellent. Thank you. So definitely, we do receive messages through the portal or through the regular phone number, and what we normally do is we have them triage usually through a fellow, and we'll decide whether we can do like a virtual check-in and put them into clinic schedule and do a phone call right then and there. So we usually have our fellows actually running the call center every afternoon, normally while we're actually running clinics. So our fellows are definitely trying to manage the phones as well as seeing patients with us in the clinics as well. But again, this platform allows us to potentially do a virtual check-in as a phone call rather than just a simple phone call. Sometimes it's a little bit more in need, and we're working really hard on trying to improve that accessibility with our patients. We are trying to streamline. Hopefully, we'll be able to come up with just one phone number in the near future. We're going to be working on that to help able to improve accessibility and hopefully get a live person answering the phone, not a machine anymore. So we're working on that hopefully in the near future. Hopefully in early fall, we'll have more information about that. So So now I want to make sure that people if they have questions, to remember to ask questions using the question and answer or the chat. But we have a question and answer box that you can be found on the bottom right hand of your screen all the way to the right. If you hit there, you can type in a question, and if I see a question come up, I'll definitely be happy to answer it with Dr. Torres-Yaghi and myself. But we also had some questions that were submitted as well. So the first question, we've got a lot of questions regarding the nilotinib trials. Nilotinib, as everybody knows, also known as Tasigna. If you've never heard of it, it's a drug that is used for the treatment of CML type of leukemia. It's been around for many years, and with a lot of work that was done by Dr. Musa, we in preclinical and animal models, we went ahead and did phase 1 and phase 2 clinical trials in Parkinson's disease and in Alzheimer's disease. And now Dr. Torres-Yaghi and I are co-primary investigators in a nilotinib trial with Lewy body disease, which we're currently doing. In terms of the results, so the results of the phase 2 trials were published in December of 2019 for the Parkinson's disease, placebo-controlled portion of it. And then in May 28th of 2020, the Alzheimer's disease studies. And both studies really did teach us that nilotinib is a potential treatment to reduce misfolded alpha-synuclein in Alzheimer's disease. It reduced beta amyloid and tau, and in Parkinson's also reduced tau. And in both disorders, we also saw dopamine production going up. What's happened since then, in March of 2020, during the pandemic, a small pharmaceutical company was begun by the university, and now they're in charge of getting the hopefully getting phase 3 clinical trials in Parkinson's and or Alzheimer's. And hopefully we'll see in the future Lewy body disease. But not only does the company hold the fate of nilotinib, it also holds the fate of another drug that we're currently doing research in, bosutinib, as well as other drugs that have been discovered by Dr. Musa. Dr. Musa, myself, and Dr. Torres-Yaghi do consult and advise the company, but if there are any phase 3 clinical trials, because of the conflict of interest, probably phase 3 will not be done at Georgetown, but we'll definitely make sure that there's sites nearby if there are phase 3 clinical trials that our patients could be part of. But these phase 3 clinical trials would probably be multi-center clinical trials, but more to come in the future. But hopefully more research will continue with nilotinib and other products. And there's a lot of other exciting products as well in clinical research. And Dr. Torres-Yaghi and I are currently involved in a lot of different trials. So Dr. Torres-Yaghi, what are the current trials that we're doing right now with Lewy body disease?
Great. So I wanted to also say, from a clinical trial standpoint, being a fellow with this Fund a Fellow program has just been one of the most wonderful opportunities that anyone can ever have. You know, when I was a resident, I still remember meeting Reversa Mills, the first Fund a Fellow fellow, and it was part of that positive energy and positivity and great education that trickled down, I think, from Dr. Pagan, that got me involved in research. When I was a medical student, I don't think I thought so much about research. I was very clinical. So I was able to really understand clinical research through the fellowship. And I was able to work on these cutting edge therapies. At the time, I remember, you know, thinking about a leukemia medication for Parkinson's disease or Lewy body disease. How does that work? And I still remember, you know, speaking at length with Dr. Pagan and Dr. Musa about the mechanism of action and why it would work. But now, you know, we've really been able to see things come to fruition. And I've been able to work with Dr. Pagan and be helpful to continue to help advance his research and Dr. Musa's research. So now we have 3 clinical trials. That's right, I know, and my research. Dr. Pagan always reminds me that I am now his colleague, and he's the best mentor in the world to allow for that. So thank you. And so now I'm able to work with my colleagues to advance this research. And I have to tell you, when we have 3 clinical trials for Lewy body disease, all using tyrosine kinase inhibitors, we have one called the KO706 trial, we have one using nilotinib, and one using bosutinib. This year, we did also complete another clinical trial, which was an Eli Lilly clinical trial using a novel drug mechanism called a D1 PAM modulator. That's we finished enrollment for. But at one point this year, we had 4 clinical trials ongoing for Lewy body disease. Now, after we created the Parkinsonism and Dementia Clinic, there was a new organization called the Lewy Body Disease Association, which was granting Research Center of Excellence designations to 24 institutions. We are now, we have been since 2018, an LBDA RCOE, Center of Excellence, and partly because of all the clinical research we're doing. And we sit on the board with all these institutions. And Georgetown has become one of the leading sites out of all the 24 institutions in the country for Lewy body disease research.
And Dr. Torres-Yaghi plays a huge role in that. So he's done a tremendous job. So what a huge investment Dr. Torres-Yaghi was. Thanks a lot to the FundaFellow Foundation, because this is what it's all about, you know, educating neurologists, and they give back in 10, 20, 30 fold. So it's quite amazing to see what our fellows go on to do, not only here at Georgetown, but all across the country. So we have a couple of questions that have come in. One of the first questions that I see is that, you know, how many Parkinson's patients have been treated for COVID-19 at Georgetown University? And actually, Dr. Torres-Yaghi and I were discussing this prior to coming on this to this meeting, that we're just aware of one Parkinson's patient actually contracting COVID-19, and it did not, and that particular person, from my recollection, did not require hospitalization. So I think we've been fortunate. I think a lot of our Parkinson's patients have really done the right thing, staying away from crowds, socially distancing, washing their hands consistently, and taking the necessary precautions. So as far as I'm aware, I have not seen a Parkinson's patient admitted to Georgetown University Hospital. At one point, we're peaking probably somewhere between 120 to 150 cases a week or a day at Georgetown. When all began with the first 4 cases in DC at Georgetown. And I think we've been pretty much running between 2 to 10 cases now every day at Georgetown. So we've really seen the number of cases really come down. We probably were peaking sometime in April and May, and then by July we started to see those numbers come back down again. Another question, Dr. Torres-Yaghi, how would you advise somebody with Parkinson's needing immunizations? What would you say to them?
So we say that, you know, we would continue on with, so a non-Parkinson's patient and a Parkinson's patient, we would keep the same recommendations. So I think it's important to, as Dr. Pagan said, maintain that adequate level of medical care. And part of that adequate level of medical care is receiving vaccinations at the right time points in life. And so we do recommend to go ahead with vaccinations, to get the flu vaccine every year, and to undergo any of those other vaccines that are necessary at certain stages in their 60s and beyond. So it does play an important role, vaccination therapy, because we don't Parkinson's disease itself won't predispose us to any complications from these infections, but the age range of our patients can, and so it's important to keep our patients as safe as possible with vaccinations.
Yeah, I would definitely recommend for our patients to get the Pneumovax vaccination if they haven't had it. In fact, when I just recently turned 50, and my doctor helped me celebrate it with a Pneumovax vaccination, so I met the goal. So definitely the flu vaccine every year. We definitely recommend that, especially this fall. I would definitely always recommend getting the flu vaccine as something that's required by us. All healthcare workers are required to get the flu vaccine every year as well, and we're required to do so, and we do get it. I also always recommend our Parkinson's patients to decrease the risk of the flu, decrease the risk of pneumonia as much as possible, because again, any infection, whether it's pneumonia, whether it's a flu or COVID-19, could definitely make the Parkinson's worse. So we want to try to minimize the amount of infections. Another popular immunization that we're seeing a lot of our patients receive is the herpes simplex virus, or the zoster's virus, the zoster's vaccination to prevent like the shingles. We do tend to see, especially as we get a little bit older in age, above the age of 60, the incidence of having shingles does become a little bit higher. So these are types of immunizations that I think could benefit Parkinson's disease patients. So prevention is something that I think is very important. The other thing we want to mention is that there's been a lot of new medications for Parkinson's that have recently been approved. Can you run through the list of a few of these medications and what their indications are? So the new ones have been Covet, Ongentys, Kinobi, Noriance. Did I miss anyone? Inbrija. So can you just mention some of these new medicines that we've seen, especially in Parkinson's?
Yeah, sure. So part of the fellowship is not just diagnostic, but it's also a very therapeutically driven fellowship. And so learning the best way to best address each symptom with our patients can really effectively be done with all of these newer therapeutics. And so Dr. Pagan mentioned several. I think in 2018, we had Xadago and Gocovri. Xadago was a medicine which is a monoamine oxidase inhibitor, very similar in action to rasagiline and selegiline. And so many of you may know that. It can be used as an adjunctive medication to carbidopa-levodopa therapy. Dr. Pagan mentioned Gocovri, which also became available in 2018. And we use that for levodopa-induced dyskinesias. So we can use that medication. It's taken once a day, and our goal is to provide stability, to smooth out those levodopa-induced dyskinesias with a nice medicine like Gocovri. After that, we had Inbrija, which was an inhaled levodopa, which was used for on-demand therapy for wearing off. And so the goal was to bypass the dysfunction in the gut and to use an inhaled therapy to bring someone from an off state or a return of symptom state where patients feel symptomatic to an on state where the medicine is on and helping patients reduce symptoms. Another medicine that became available at the end of 2019 was Nuriance, and that's, Dr. Pagan always teaches, our medicines can be based on, we have medicines that help step on the gas, and we have now this one medicine that helps pull our foot off the brake while we're stepping on the gas. So if you think of a go-kart, not a car, because you're not going to hit the gas and the brake of a car, because that won't make sense. But a go-kart, you drive that way. And that's how it leads to movement. So there's a new medicine called istradefylline or Nuriance, which helps us take our foot off the brake to help enhance movement. And in 2020, we hope to see a new medicine called Kinobi, which is a sublingual apomorphine. It's Apokin. which is a dopamine agonist that also acts very similar in terms of its effect to bring someone from an off state to an on state at the 10 to 15 minute mark and maybe earlier. And then Ongentys is what Dr. Pagan also mentioned, which is an extended release formulation. It's a COMT inhibitor. If you guys are familiar with Stalevo or entacapone, that compound helps extend the duration of effect of carbidopa-levodopa. Now, in the next few months, we'll be able to prescribe a new once-a-day medicine to help extend that duration. And we have so many things in clinical trials as well coming through soon.
Yeah, so it's just a real exciting time. And, you know, I think the one thing is that we're really getting better at individualizing therapy. We have more than just one drug. So sometimes makes my heart ache sometimes when I meet a patient with Parkinson's. For the last 17 years, they've only been on one medicine their whole entire time, and it hasn't been optimized. So I think it's always important to know that there are new medicines, there's new adjunctive medicines, there's new treatments that are currently being done in research, better ways to deliver levodopa, longer-acting levodopa formulations, and in other adjunctives, so drug delivery systems, et cetera. So remember, before you come to see us, one thing that may be beneficial for the patient or the caregiver is, especially the 3 days before, pay attention to how well your medicines are working. Are they lasting till the next dose? Do you see the return of symptoms before you're due for your next medication? Are you having extra movements? Are you slowing down? Are you freezing? Are you taking small steps? Do you feel foggy brain? Do you get anxious, anxiety, sweats? All these kinds of things. So learn what an on period is, what an off period, some of the symptoms that you have when the medicines aren't working, some of the symptoms that how you feel when the medicines are working. So try to figure out to best evaluate it. And sometimes this may be something that a spouse or a family member may be able to do right before they come to the next visit, to be able to give the proper information of how well the medicines are working. Because as Dr. Torres-Yaghi just stated, we have medicines that can help enhance the main medicines like carbidopa-levodopa, and when they're not working, we have these on-demand therapies like the inhaled levodopa, the sublingual apomorphine, so that's Inbrija and Kinmobi respectively, or an injectable apomorphine, which is called Apoken. So we have maintenance medicines and on-demand therapies. So really the way that we've been treating Parkinson's is definitely shifting. So there's a lot more to come, and a lot of great things to learn still to ultimately really help our Parkinson's disease patients and their families. So in keeping with the schedule, I just want to really thank again the development program, Rick Shenna and Janice Buchanan, and my colleague Dr. Torres-Yaghi here for being here with me this evening on this panel. Thank you everybody for the great questions. Now I'd like to introduce again one of my senior fellows. I got two amazing senior fellows. I'm going to introduce to you Dr. Akano to just kind of share a little bit about his story and how things have been going with him in movement disorder. So thank you, Dr. Akano. Thank you so much. And thank you, everybody, for joining us this evening. From the bottom of my heart, God bless you all. Stay safe, and I look forward to we can hug each other again. God bless. Bye-bye.
Thank you, Dr. Pagan. And so I'd like to start off by saying thank you very much for joining us tonight. It's generous of you to open up your homes, inviting us in, and sharing your time with us. So I, from the bottom of our hearts, thank you very much. I'd just like to start off by talking a little bit about me. My name is Stephen Akano. I am a Colorado boy at heart, grew up in the Rocky Mountains. I went to medical school at Marshall University in Huntington, West Virginia. And then I was fortunate enough to end up at Georgetown for my neurology residency. And so I've been tasked with the task of giving you a kind of candid view of what goes on behind the curtain And so the first thing is that I'll share with you that getting a movement disorder fellowship slot is not necessarily a hard thing to do, but getting the right one is. And being on the outside looking in, meaning going through my residency at Georgetown and seeing the movement disorder program as an outsider, it gave me a goal of something that I wanted to accomplish. You know, as anyone can tell you, seeing the way that the movement disorder program is run from the top to the bottom is, you know, seeing that, it made me know it was something that I wanted to be a part of. And a big part of that is just the uniqueness of the Georgetown department. And so, you know, the first part of that is the patients. You are the practice, and you are as much responsible for the personality and the culture of the practice as anyone that's on the clinical or the treatment side. And so we're very thankful for your experience and your expertise as we kind of travel this path with you. You know, the fellows, as we travel, learning about movement disorders and how to interact with patients and how to help you navigate these kind of sometimes uncertain waters. You know, and then next is Dr. Pagan. As the captain of the ship, he certainly steers us in the right direction, gives us a pathway on how to move forward, but it doesn't stop there. You know, if you were giving orders to an empty boat, it'd be stuck in the water. And so I can't speak enough about the department that he's really built from the ground up. The other attendings that we're allowed to work under and learn from, Dr. Torres-Yaghi, Dr. Baru, Dr. Amjad, Dr. Lowe, Gambir, Mundell, and Barb Wilmarth, who, you know, being able to interact with all of these individuals, see how they approach problems in movement disorders, see how they interact with patients, see how they treat them. It gives the fellows an invaluable learning experience on what the scope of movement disorders can encompass, and also the equally wide range of how you treat those individual problems that you run into. It doesn't stop there. You know, we have an incredible administrative staff that helps us with all of the things that, you know, for us are a click of a button or a message that we send through the portal. But, you know, Joy and Helen and our office and administrative staff, I can't tell you how much, how hard they work behind the scenes, whether it is, you know, getting that order for home health or making sure that package of medication goes out on time. Those people really are the pulse behind what keeps the program running. And so, you know, lastly, I'll try and keep it short because I think we're coming up on time here. But despite the ongoing and seemingly infinite and unending construction project going on the Georgetown campus, you know, the Georgetown Medical Center's pockets are not bottomless. And employing 5 fellows is an expensive thing, but not just in a financial sense. Investing in fellows is an intensive process. It's time intensive, and it's cognitively demanding. It's emotionally intensive. But Dr. Pagan has chosen to make this a priority for the movement program that he decided to build. And so I think that it's obvious that the fruits of his labor are already beginning to show. You know, Dr. Torres-Yaghi, who was responsible for most of the information that you learned from him tonight, a big part of his tutelage was due to Dr. Pagan. And so this program, this personality, this movement disorders program that he has built that fosters an educational environment that brings up neurologists and specifically movement disorder specialists that see movement disorders the way that he does, that like to approach problems thoughtfully, taking into account the disease pathology and the person as a whole, and also their needs and how we address the pathology and we take care of the patient, and how we do those things at the same time, which counterintuitively is not always the goal is not always the same. And so, you know, with that in mind, I just want to, again, thank you all for joining us tonight. I can't be thankful enough that you would choose to spend the time with us. And additionally, I would like to thank the Georgetown Movement Disorders Program. You know, being a part of it, learning to practice medicine in this situation is a experience that I would not get anywhere else. And even if I don't end up staying in the Washington, D.C. area, which is always something hopeful, having Dr. Pagan just a short drive down the road away would be helpful. But, you know, it speaks to having had 30 some odd fellows that he has trained and taught to think about movement disorders and shown how to treat patients, and having them spread out across the country, I think will only make the horizon and for what it looks like to treat patients with movement disorders. I think it'll make the country a better place.
Thank
so
you, Dr. Akano. Thank you. And not only are we training fellows, I always think about training my future colleagues. So, and I treat them as colleagues. So, thank you again. So, Mark.
Thanks, everyone. And thank you for joining us this evening. As Rick mentioned, this is hopefully our first of several of these virtual events, and we'll need your feedback for improvement. So please keep your eyes peeled for an email coming from us in which you could share suggestions for how we might do this better next time, but also topics that you'd like to hear us discuss at future events. And the hope is to have our next virtual event in October. So please look for a save the date coming soon. And again, thank you to all of our generous donors supporting this important program. And as Janice mentioned, these fellowships are funded entirely by philanthropy, so every gift really makes an impact. And to learn more about supporting this work, please go to the link on your screen, or feel free to email me or pick up the phone and give me a call. Thanks so much again for joining. Wishing you all good health and safety in the months ahead. And this concludes our evening. Thanks.